Hello and welcome back to the Author Roundup, a special segment of the Book Connection Show where we meet up and coming indie authors and talk to them about the recently released books. Welcome back again. This is Ray Walters. Picture a not-so-distant exam room where software reads scans in seconds, your notes write themselves, and robots quietly take on tasks that used to demand 3 extra hands. The technology is impressive, but the real question is sharper. How do we bring AI and robotics into medicine without letting the human part leak out of the system? That's a tension at the heart of the doctor's future, a practical blueprint aimed at helping clinicians and healthcare decision makers prepare for an AI robotics powered era without sleepwalking into ethical, legal, and trust related messes along the way. The book walks through where AI is already showing up. What can go wrong when systems move faster than regulation and training, and why a harmony mindset, balancing efficiency with empathy and innovation with clear moral guardrails, must be the goal. Our guest today brings the conversation down to ground level, a working physician who's seen modern healthcare from the inside and is focused on helping the profession adapt with clarity rather than panic. So, with that, let's get into it. Please welcome Dr. Pietro Emanuele Garbelli. Dr. Garbelli, welcome to the Author Roundup.
Thank you for having me, Ray.
Congratulations in getting this book published.
Thank you. It's an honor to be a guest of your program.
Very interesting book to discuss for today's episode, really. AI and healthcare. AI is everywhere as long as you're digital. One way or another, you will be interacting with either a chatbot, you'd be interacting with your phones, processing requests, but this is somewhat on a higher level. Um, so if you had to give the thesis of the doctor's future in one sentence to a busy clinician, what would you say, and what would you want them to do differently after hearing it?
Um, it's clear that AI and robotics will transform medicine, but the judgment of doctors, the empathy, and the leadership will remain the irreplaceable center of care. And clinicians must actively shape the future rather than be shaped by it. What I would like them to do differently is to stop seeing AI as a threat or as a miracle and start treating it as a clinical tool that requires the same scrutiny and training and ethical discipline as any other intervention that we use in medicine.
All right. When you say AI and robots are already here, what are the real changes you see showing up first in the everyday clinical work?
Obviously, the first wave isn't full humanoid robots like we have seen in many movies.
Yeah.
It's automation that is invisible. Clinicians already see that in, for example, triage algorithms, reporting of images, supporting documenting, automating workflows, interpreting real-time images in ultrasonography, and
Hmm.
precision surgery that is assisted by robotics. The shift is very subtle at the moment, but profound. It means spending less time on administration, having more support on complex decisions, and ultimately having more time for human connection.
All right. In your view, what's the first moment where clinicians most often hesitate with AI, where trust starts to crack, and why?
The trust usually cracks the very first moment AI gives a recommendation that is not in alignment with the intuition, experience, or the clinical picture in front of a clinician. That's the psychological hinge. When the
Mhm.
machine says one thing and the clinician feels another. Hesitation is not only natural, it's appropriate. The deeper issue is that most AI systems still operate as black boxes. They don't explain how they reach a conclusion, what data they rely on, or whether
Uh,
that data was even validated by experienced physicians. Clinicians are trained in what we call evidence-based medicine, where every
mm,
recommendation can be traced to a study, a guideline, a rationale. AI doesn't follow that logic. It doesn't
okay.
mirror this structured, transparent process that clinicians use to translate scientific evidence into diagnosis and treatment. So when AI produces an output, we often don't know the origin of the data, the assumptions behind the model, the specific
Mm,
reasoning that is applied to that specific patient's case. And that lack of explainability and transparency, combined with the risk of bias or unvalidated data sets, is where the trust starts to erode. And until AI can show its work in a way that aligns with clinical reasoning, clinicians will continue to hesitate, not because they fear technology, but because they know the stakes.
okay. Doctor, people like myself, we get dazzled by new, quote unquote. I want your filter, um, your way of calling a new tool good, not just shiny, not just new. So, what's your simplest test for separating an AI tool that genuinely helps care from one that just adds noise, risk, and especially burden?
That's a very good question. My test is very simple. A good AI should reduce cognitive load, improve accuracy, or give clinicians more time with patients. If it doesn't do at least one of these things, it's not helping. It's just adding noise. A genuine useful tool feels almost invisible. It disappears
Okay.
into the workflow. It makes repetitive tasks automatic. It handles administrative burden,
Mm,
analyzes large volume of data that our human mind can simply not process at the same speed or the same scale. And it should enhance our clinical reasoning, not complicate it. The moment a tool adds extra steps, creates ambiguity, increase documentation time, or forces
right.
clinicians to work around it, it becomes a burden. And in healthcare, adding complexity is not just inconvenient, it
Mm,
introduces risks. So my filter is straightforward. I ask three simple questions. Does it simplify the clinician's day? Does it improve diagnostics or accuracy? Does it
okay.
give time back to patient care? If the answer is yes, it's worth adopting. If the answer is no, it's just technology for technology's sake, and it has no place in clinical care.
All right. Now, this is where your book becomes empowering instead of intimidating. How clinicians lead transformation rather than react to it. So, in your book, you emphasize doctors staying central in the AI robotics era. What does what does that look like in a real world, day to day, not just on a mission statement?
It means doctors must be at the helm of how AI and robotics enter clinical practice, not be passive users, but professionals that lead the design, the evaluation, and the
Mm,
governance of these systems. Clinicians should be the ones defining what is safe, what is useful, and clinically meaningful, what that means in real world care. Day to day, this might look like doctors deciding when to trust an AI recommendation or when to question it and when
mm,
to override it completely. It's clinicians interpreting the outputs through the lens of their experience, the context,
okay.
and the story of the patient, something that no algorithm can replicate. In practice, doctors become orchestrators of human machine collaboration. They ensure that technology enhances care rather than distorts it, And when clinicians take their role, AI becomes an extension of their expertise and not a replacement for it. That's how we keep medicine human as if even it becomes more digital. And this applies to every doctor everywhere. It starts
Mhm.
with familiarizing themselves with the technology, understanding its capabilities and limitations, and participating actively in their organization's vision for AI. If clinicians are involved from the beginning, we build systems that are truly fit for purpose, systems that serve patients, support professionals, and strengthen the future of healthcare.
Okay, you name relationship and trust as central stakes. So I love your balanced view, the danger and the opportunity. So where do you think AI most threatens the doctor-patient relationship, and where could it actually strengthen if if it is implemented wisely?
I believe the greatest threat is when AI becomes a barrier rather than a bridge. The moment a screen replaces eye contact, automation replaces a conversation, or an algorithm delivers a decision that the patient doesn't understand, the relationship between doctor and patient begins to fracture. For many patients, in particular older ones, the presence of an AI can feel like a third silent participant in the room. They're not sure who's really making the decision, how their data is being used, or whether the technology can interpret their emotion, their fears, and the subtlety of their story. And if the AI is implemented poorly, it risks creating more distance, less human connection, less trust, and more confusion about how decisions are made. And once trust erodes, the entire therapeutic relationship is at risk. But the opportunity is just as powerful.
Okay.
When AI is used wisely, it can remove an administrative burden that has been suffocating clinicians for many years. It can accelerate diagnostics. It can surface insights that would take hours to analyze and handle repetitive tasks that pull doctors away from patients. In that scenario, AI doesn't replace the relationship, it makes it stronger. It gives clinicians back the time, the presence, the emotional bandwidth to be more human, to be more attentive, to be more connected than ever. So the question is not whether AI will change the doctor and patient relationship. It's whether we design it in a way that protects the heart of medicine, which is trust, empathy, and genuine human care.
Makes sense. You make the case that old models of professional development can keep up. So I want your practical blueprint for readiness. If training is the bridge to safe adoption, what should modern AI robotics training for clinicians include that traditional medical training doesn't?
Traditional medical training was designed for a world where knowledge changed slowly and technology was just in a supporting role. In a healthcare system that is enabled by AI, that model is not enough.
Okay.
Clinicians now need training that builds judgment, digital judgment, not just clinical expertise. First, the training has to be bespoke. Every
Mm,
clinician has different responsibilities, different skill gaps, different learning styles, and we cannot keep giving everyone the same generic modules. We
yeah,
need
definitely.
something that is adaptive, that is role specific, and evolves as the clinician's competence grows. Secondly, clinicians must learn to think critically about AI itself. That means understanding how algorithms are selected, trained, validated, monitored. They need to know how AI systems fail, how bias creeps in, how to challenge an AI output rather than accept it as face value. Thirdly, organizations need to train clinicians to operate within a clear AI safety framework. Doctors should be able to spot risks, opportunities in AI and robotics implementation projects. and as importantly, know when not to use AI in a clinical environment. And fourth, hands-on experience is essential. You cannot learn robotics or automation tools from a slide deck. You need practical exposure to human-machine workflows, failure modes, and recovery protocols.
Yeah. Okay.
We also have to teach the ethical and legal reasoning that comes with the digital age dilemmas. Accountability in shared decision making, transparency with patients, and what to do when the AI system gets something wrong. And finally, communication skills matter more than ever. Clinicians must be able to explain AI-supported decisions in a way that maintains trust and helps patients feel informed, not replaced. And if I had to summarize it, I say traditional teaching teaches knowledge. Modern AI robotics training must teach judgment, the ability to navigate a hybrid human-machine environment with confidence, curiosity, and critical thinking.
Okay. When an AI supported decision goes wrong, okay, what principles should guide accountability so clinicians aren't scapegoated, patients are protected, and systems learn?
Accountability must be shared, not shifted. It must go hand in hand with a robust framework for clinical governance and training, and with reforming the legislative frameworks for liability and reimbursement, including insurance and malpractice.
Okay.
Clinicians remain responsible for clinical judgment.
Mm.
Developers are responsible for system integrity and transparency, and institutions are responsible for governance, training, and safe deployment. The goal is not blame, it is learning. Every failure should lead feedback into safer systems and better practices.
What ethical boundary do you think healthcare systems must refuse to cross, even if an AI tool is efficient or profitable?
That's a very good question. The line we must never cross is the one where human life becomes a data point and
Hmm.
clinical judgment becomes optional. The moment we reduce the value of a person to a utilitarian calculation or a number on a spreadsheet, we lost the essence of healthcare. AI can support clinicians and organizations, but it must never be allowed to replace or override the doctor's duty to act in the best interest of the patient. Practicing clinicians must remain the guardians of ethical decision making and human oversight, informed consent, and the right to question an algorithm output. Those are non-negotiable. Efficiency and profit are not ethical justifications for removing human judgment from care. We
Hmm.
must embed human ethics into every algorithm we deploy and ensure that no system, no matter how advanced, prioritizes optimization over dignity, over safety, or compassion.
You describe gaps between regulation and reality. What's one hole in the system that worries you most, and what would you fix first?
Right now, the accountability model in healthcare is
Mm.
fundamentally flawed.
Okay.
We are handed a product that often isn't clinically validated, and yet the responsibility for outcomes is pushed entirely onto the healthcare providers. If something goes wrong, it becomes the hospital's problem, not the developers. And the burden has to be shared. Tech companies, governments, and healthcare organizations must operate as equal partners. At the moment, the system disproportionately favors big tech. They can deploy rapidly while healthcare is left to figure out how to use the tool safely, and to absorb the consequences when they don't work as intended. We need the freedom to say the system doesn't work and to
Mm.
demand continuous improvement, not a one-off release. The biggest structural issue is the gap between the speed of deployment and the speed of validation. We
Okay.
have consumer-grade algorithms entering clinical environments without anything close to the rigorous longitudinal testing that we require for example, for drugs or medical devices. And that
Yes.
is unacceptable. The first fix is simple. Introducing mandatory standardized evaluation frameworks before any AI tool touches a clinical workflow. Not optional, not
Mhm.
advisory, but mandatory. And
Okay.
those frameworks must create shared accountability between tech developers, healthcare ministers, and clinical organizations. Until we build that partnership and stop talking only about finances instead of outcomes, we will
Mm.
continue to adopt too slowly, validate too slowly, and expose patients to risk unnecessarily.
Speaking of frameworks, if a hospital leadership team wanted to apply your healthcare convergence framework this quarter, what are the first two, three moves you'd insist on before expanding AI robotics use?
Like in clinical practice, the first step is always diagnosis.
Okay.
I would ask the organization to take the Healthcare Convergence Framework AI and Robotics Readiness Test, which is available freely on my website.
Mhm.
It's a clinically informed, board-ready assessment that evaluates the organization across 8 critical domains of the Healthcare Convergence Framework. Once done, the leaders will receive a full report which contains a visual heat map of risks, readiness gaps, and tailored strategic recommendations, and a roadmap for short, mid, and long-term AI enablement. This
Mhm.
gives everyone a shared evidence-based understanding of where they actually stand. Second move is to map the current clinical workflows, not to chase trends, but to identify where AI and robotics would truly add value, where it would improve safety, reduce friction, or enhance patient experience. This would prevent organizations from deploying technology just for the sake of technology. And third, I would insist on establishing a multidisciplinary governance group with
Okay.
practicing clinicians at the center and a team that becomes the ethical and operational anchor for everything that follows. Once that is in place, you run controlled pilots with clear metrics for safety, efficiency, and patient experience before scaling anything. And those 3 steps are what creates a disciplined, evidence-driven foundation that turn AI adoption from a reactive experiment into a structured transformation that protects patients, supports clinicians, and delivers measurable outcomes.
Okay, doctor. We've come to the last question, and before I wrap up, I know there might be interested viewers and listeners out there who might want to go ahead and grab a copy of your book. Where can we direct them?
It is literally everywhere on every every bookstore. It's available in multiple formats, including audiobook. It is also now available in Spanish and in Italian.
That's great. It's available on Amazon, I believe, and
It
on
is indeed.
your publisher's website. I think I did come across your book on Goodreads.
It is on Goodreads as well,
All
and it's
right.
gaining momentum with wonderful feedback.
I did see feedback on the Goodreads site. Doctor, okay. My last question to wrap this one up is, looking ahead, what do you most want clinicians and healthcare leaders to protect as AI robotics expands? And uh, what's your because this is very interesting for me. So
Mhm.
exciting question to ask to close this interview with you.
I believe we must protect the human core of medicine: empathy, trust, clinical reasoning, and the therapeutic relationship between doctors and patients. Technology should help amplify this, but never replace them.
Yes, I agree. Definitely. Dr. Garbelli, thank you so much for your time. This
It's
has been
been
a
a
very
pleasure,
interesting, the pleasure is mine. It's been an interesting conversation actually for me. I've learned so much about it.
and I'm looking forward to connect with a lot of readers. You can find me on my website, drgarbelli.com, and on social media as well.
All right, we're going to make that the link of your website available on the description box on YouTube and on our podcast channels. I also would want to give a big shout out to our awesome viewers and listeners for joining us for this interview. Stay tuned for more inspiring conversations on the Author Roundup. I'm Ray Walters. Join me next time as we explore the world of supported self publishing, one indie author at a time.